All right. Just in the past few minutes, Dr. Gordon, you used the word stress. We are all feeling a ton of stress. And I have always been a pretty laid back person. And then menopause hit, and I'm like, yeah. So if we could just spend a few minutes talking about stress, anxiety, how to deal with it at this particular season of life. Whoever wants to go for, actually, do you want to go ahead, Dr. Basilico?
Sure. I mean, I think stress is really common in all periods of life, and definitely there is something about menopause. I am a very practical person. I like to go back to basics. I mean, the first place that I think is really important to think about when we're thinking about stress is sleep. I know that is, it's a very strong menopausal symptom. It's certainly a symptom that or it can, sleeplessness, insomnia can very much affect your weight. So want to focus kind of on, getting back to basics. How are you sleeping? Again, for weight, it can, insufficient sleep can affect your hunger hormones. It decreases your satiety hormones, and it also makes you more likely to want to eat for pleasure, right? Because you're looking for a reward because you're tired. So I try to look at the basics, and then we do try to use just evidence-based treatment, CBTI, cognitive behavioral therapy, but it is and validation, right? What you're not crazy, what you're feeling is normal, and this is what we've got to help you.
Oh, I don't feel normal sometimes, Dr. Gordon. So, what do you have to say on the stress and anxiety topic?
Yeah, I mean, I think I agree with everything you said. We also know that estrogen levels affect our brain, and our serotonin and dopamine receptors are impacted. And so there's also a real impact of that shift in hormone and how it affects our neurotransmitters. Um, so, I think absolutely sleep, therapy, all the things that we do to help us stay grounded. I also want to call out that folks, the biggest predictors of having depression or anxiety in menopause are similar to the other times in our life, having a prior episode of a mental health challenge, and especially around a hormonal transition. So often when I see somebody, I'll ask them, how was postpartum if they were postpartum, right? How, if they've had a prior episode of anxiety or depression, that often surfaces again during this other hormone transition, right? The fluctuations in hormones are just extreme. So in perimenopause, giving estrogen is just as effective as using the SSRIs. And so often, if a patient's gone to their primary care doc with multiple symptoms, or their OBGYN or whomever, and their care doc has offered them an antidepressant, that's still the most effective treatment for depression or anxiety generally. But estrogen can be just as effective, and sometimes both are needed, and sometimes they work synergistically together. So I think keeping in mind that hormones are a key component, and can really help. I think the data, like I said earlier, about that mental health shift on the other side of the menopause transition is a little bit less clear. I think people are looking at testosterone and how it impacts cognitive function and mental health. We don't really have all the information yet. But sometimes hormones can help with anxiety after menopause. It's not data driven, it's not scientific, but I think for some patients it's meaningful.
Just one more thing before we get to questions. Get those questions ready, and Shyla will come around with a microphone. But I'm sitting here listening to myself going, oh yeah, that's hot flashes, and my hips are killing me, and I'm stressed out. And I must sound like a miserable person to you. I'm not. You just deal with it. But you mentioned brain fog, and there's another thing where I'm going, yeah, that too. How do we deal with that? And that is normal?
So brain fog is a really interesting one. I tend to think of it as this umbrella of many possible pathways, right? So sometimes brain fog is hormonal shift, like estrogen, but sometimes it's poor sleep quality, right? Or an emergence of sleep apnea that someone may not know that they've had, right? Affecting how well and deeply they're sleeping. It could be that they have depression, right? That can cause brain fog for folks. It could be an unmasking of ADHD. It is becoming increasingly common for, I see some head nods around the room, right? For women who have been able to mask or just not have the same impact from ADHD, kind of enter perimenopause, the change in hormone fluctuations and the impact on our dopamine receptors and the variety of other things, suddenly we have ADHD. And giving estrogen for what we think is hormonal brain fog, which I mean, it may be, doesn't fix that brain fog. When that happens, I'm always suggesting to folks like, you need an eval for these other possible things because there might be a different treatment that's actually going to improve your brain fog. The data we have says that sort of the perimenopausal brain fog that's hormonal will improve on the other side of that hormone fluctuation. Our brains don't recover exactly how they were, but because we are strong and amazing, and brains are strong and amazing, we do develop some other areas of our brain that were maybe not activated beforehand that are compensating. And so a lot of people will feel less foggy on the other side. They might not feel exactly the same as they were, but it does get better.
Dr. Basilico, anything to add? Don't say no.
About brain fog.
Yeah.
I mean, I think it's really common, and I think that common and it should be addressed, right? I mean, again, I think that thinking about so many of these menopausal symptoms, women are often undertreated. We know that, right? And we also know that women with obesity are even less treated than other women. And we know that increased, I'm going back to weight, right? Because,
That's your thing.
increased menopausal symptoms is actually also associated with increased weight gain during the during the transition. So, these symptoms are all normal, but that doesn't mean that we have to necessarily, that we have to suffer through them. And I agree with Dr. Gordon that, patient that we need to listen to our patients and figure out how these symptoms are affecting their life. And whenever we make a decision about starting a hormone treatment or any an anti-obesity medication, if somebody has obesity, you're making a decision about what the pros and the cons of the treatment are. And that's kind of how you approach it. And so, there are a lot of things which are low risk, right? We know that, going to the gym is very low risk, right? It takes a lot, but there's a lot of things that we can do to try to improve symptoms, and we just need to keep listening to people and hearing what they're experiencing.